Gary Bard, founder and editor-in-chief of today's Caregiver magazine and Caregiver.com, host of the 286 Fearless Caregiver conferences held across the nation to date, author of the new book about COVID-19 caregiving, You Are Not Alone, and your host for this video series, COVID-19 Caregiving Conversations. Our goal, as with all we do, is to help family caregivers learn about the people, support, and services you need to best care for your loved ones and for yourself. One of my favorite parts of what we do is when we spend the day with our fellow family caregivers at the Fearless Caregiver conferences. Of course, this is not presently possible due to COVID-19, so we hope to be able to continue this interaction with you virtually until we can once again spend the day together. One of the most important concepts that we've all heard about since the beginning of this pandemic is telehealth. So I thought it'd be a good idea to talk to Jim Riley, Vice President of the Healthcare Division of Connect America, to give us some more insight on telehealth and what it means to family caregivers. By the way, Connect America is today's Caregiver magazine, caregiver-friendly, award-winning organization. Jim, how have you seen COVID impacting the care environment, especially for family caregivers?
Connect America has been around for 35 years, is a very experienced leader in this space of remote patient monitoring, which includes telehealth. We are a national company and we care for well over 1 million people since our inception. I think that the goal for not only for both formal and informal caregivers is to improve the quality of life. I think it's to reduce hospital admissions, higher level of care, and to take pressure off the caregivers. Overnight, COVID-19 has accelerated the adoption of telehealth like I've never seen before, okay? Probably, people are saying that it's probably accelerated about 10 years. The government allowed the use of a telephone, telephonic care, something we've never seen really used for treatment and evaluation and management of disease. So for people that didn't have a smartphone, access to a tablet or computer, they were actually able to have their doctors and doctors' extenders treat them and assess them over the phone. You know, groundbreaking.
What aspects to telehealth do you think are going to become permanent due to COVID-19?
Up until COVID, your own home was never allowed to be an originating site. You had to be in one of several authorized sites, such as a federally qualified health center, maybe a dialysis center, a skilled nursing center, but it could never be your own home. So the only way that this is going to work for the masses is that cat can never go back in the bag. The originating site must be allowed to be your home, and I, as well as other practitioners and other competitors of mine in the space, all feel that is never going backwards. Remote evaluations, and they call them e-visits by the physicians, I don't think they're ever going to be changed back either, okay? So someone from the office staff who wants to call you a couple of times a week to make sure your mom's okay, that I think is never going to go backwards. That's an e-visit, basically short visit, billable under Medicare.
Where do you see the industry in 5 to 10 years in respect to the support it offers family caregivers?
I think you're going to start seeing more sensors in the future. You're going to see smart clothing in the future that is going to send passively, because the problem with getting data sometimes is people don't want to give you the data. So if you can passively capture the data, aggregate the data, put it through your analytics, you can sort of predict, upward trends of risk, and you can have your caregiver get notified earlier, even if you're with your mom 5 days a week, Gary, and she seems the same every day, but there could be something going on that you can't see that would eventually quickly turn into something more serious. Well, I think that's where this is all going. There used to be a call, an activation, a dispatch, an admission. Those things are all changing, right? Because we have better tools, we have better algorithms, we have better operators that are triaging better, all these things. And then we have the caregivers, which are being communicated to, that can intervene immediately. Son or daughter close by, get them the house immediately, let them sort of drive the bus then, right? Yeah. And that's a real game changer as well.
Jim, what's the one most important piece of advice you'd like to share with family caregivers?
So my message to caregivers is seek information, ask questions, don't take status quo as an answer, right? If something's not right and you know it's not right, keep pushing it or escalating it so you get a proper response and someone investigates it, more thoroughly for you to get hopefully a better treatment.
I appreciate you taking the time to talk with me because I know you're pretty darn busy these days.
So my pleasure, Gary.
The National Alliance for Caregiving and AARP have just released the new study, Caregiving in the U.S. 2020. Now, this in-depth study is the most recent update of the valuable research series, Caregiving in the U.S., conducted roughly every 5 years. The 2020 update reveals that the number of family caregivers in the U.S. increased by 9.5 million over these past 5 years, and that family caregivers now encompass 1 out of every 5 Americans. The study also reveals that family caregivers are in worse health than ever. So I'm pleased to be joined by our good friend and caregiver advocate, Grace Whiting, the president and CEO of the National Alliance for Caregiving. Hi, Grace. It's nice to see you again, even if it's virtually.
Hi, Gary. Thank you so much for having me and for all the great work that you're doing for caregivers.
Can you share what Caregiving in the U.S. 2020 can tell us about caregiving in the U.S. during COVID-19?
So one of the things a lot of people are talking about now is social isolation. I think the pandemic's only made that worse. I mean, we saw in our study 1 out of 5 people caregivers saying they felt socially isolated. And then you think about not being able to leave your house for 2 months, not being able to access your normal systems of respite care like adult daycare or even senior centers or churches or other faith communities. And I think a lot of caregivers who are, particularly those living at home with someone, feel isolated. And you also have people who are caring for someone where they're physically distant and they're really not allowed to be there with that person, whether it's someone who's in the hospital, who's been quarantined, or, someone in a facility. And so they're not letting any guests in. And that's been really challenging for caregivers to be excluded from those settings when they've really been a partner in care the whole time.
One of the things I really like about the report is it details caregiving in various communities. Asian Americans, Hispanic, African Americans, LGBTQ communities, among others. Did the 2020 report offer any surprises about the similarities or differences between caregiving in these communities this year?
Yeah, I mean, so America itself is getting more colorful and diverse. And I think the data that we have tracks that. You see 40% of America's caregivers are in a diverse background. We see 10% of America's caregivers roughly who are LGBTQ. And one of the things that always surprises me, but again was present in this, is that particularly among African American families and Latin American families, you have people who report that they have less help, they have less resources, they're at lower income levels, and yet they find that they have less strain overall. And we asked a new question this year about the positive sides of caregiving.
Yeah.
Roughly half of people said they have a sense of purpose, but those positive emotions are higher in African American communities and Latin American communities. So it does make you think there's something about this cultural concept of our family takes care of itself that other communities can learn from what our neighbors are doing, and the networks where people sort of take a more holistic approach.
What do you hear from family caregivers about the study, the reports, the updates, or what have you heard over the years?
I think caregivers are excited to know that they're part of a larger movement, that it's not just individual. I mean, we think about what we do in our day-to-day, and we don't always give ourselves credit for how much we may be taking on. But in the aggregate, we're talking about one of the largest unpaid workforces in the United States. AARP, our partner, takes that data and then they amplify that and in their long-term scorecard report, and they estimate what the economic cost is. So the last estimate was $470 billion. That's how much it cost our economy for that unpaid labor. My predecessor, Gail Hunt, worked with AARP on the very first caregiving in the US in 1997. So since then, roughly every 5 years, we've come back to repeat the study. And what's exciting about the 2020 version is that we actually trended the data. So you can actually see what has changed since 2015 to 2020. The other thing that we know has been helpful is information on what kinds of services would help. Things like tax credits, paid family leave, more information and support, and just even, again, low-hanging fruit, having doctors and other providers ask, what do you need to care for yourself? What do you need to help care for this person?
Wouldn't that be nice if we're seen as more than just the person in the corner pushing the wheelchair, told what to do and go on our way, that we're seen as an equal member of our loved ones' care team, that the doctors, the care professionals turn to us and say, now what do you need? That would be wonderful.
Yeah, absolutely. And even just that recognition that you're not window dressing, but you're here, you're an active part of this.
Thank you, Grace. Thank you for your time. Thank you for all you're doing at NAC. And I look forward to seeing you again in person someday soon.
Absolutely. Thank you too, Gary. I appreciate it.
About the living will. It doesn't do any good if it's in a sealed envelope behind the nurse's station. If somebody drops it off, make sure that you stand there while it's opened, 3-hole punched, read, and then put into the patient's notebook.
If your bank, if the state, if the federal government are coming at you looking for your Social Security, your bank account number, your passwords, your Medicare number, if they're the real players, they would already have that.
That's right. And another good example, Gary, and you and I've seen this time and again, the IRS. Those IRS scams are starting back up now that tax season is in full bloom. So anyone that gets a call from the IRS, that's not legitimate. The IRS does not call people. So again, that's one good example, but there are so many others where, like you said, caregivers are fabulous at just using common sense. And, it breaks my heart like it does yours when occasionally people are fooled. So this is a time to be extra aware.